Now, on the other side of the equation, if you're not regulating water intake, you can actually regulate fluid loss. Remember that 60% of the fluid that you lose is through urination. So how can we regulate this? We talked about this a lot in the last chapter. We can change the concentration of our urine by using the hormone antidiuretic hormone. Antidiuretic hormone acts on the collecting ducts of the nephron, and when it does that, it inserts aquaporins, which allow water to travel down their osmotic gradient into this concentrated medullary area and be reabsorbed back into the blood, so that when the urine is excreted, it's a smaller amount and it's in a higher concentration. So that is one way that we can regulate fluid loss in the kidneys. And this is just showing again the way that ADH works. So when extracellular osmolality is increased, or sodium concentration in the plasma is increased, that's going to stimulate these osmosis receptors in this region right here, which is the hypothalamus, and that will stimulate ADH secretion from the posterior pituitary, which targets the collecting ducts within the nephrons of the kidneys, which leads to an increased water reabsorption, which I just talked about, and scant urine, which means only a little amount. The same thing happens if you have decreased blood volume, which is found through decreased blood pressure. Baroreceptors in the atria and large vessels stimulate the secretion of antidiuretic hormone, and then the same thing happens.